Process issues in psychodynamic psychotherapy. Transference. Transference means all the feelings that the patient has towards the therapist. Now, some of these feelings could be about the true characteristics of the therapist, and some might be related to past relationships and other people in the patient's life, which get displaced onto the therapist. Transference helps with many things. We can understand how the patient reacts in important relationships in their life, and it can also help to explore memories. There are three basic transference categories. Transference related to affect or emotions, related to past relationship, and transference that is displaced. Transference related to affect or emotions can be positive or negative. These positive feelings can be either of idealization, erotic transference, or eroticized. This would include loving feelings or desire. Eroticized transference would include sexual feelings or any aggressive feelings. Positive feelings are not interpreted because they help with alliance. Negative feelings would include anger or envy, hatred, or humiliation. Transference related to past relationship. This can be either maternal, paternal, or sibling. These can further be of two types, Oedipal and pre-Oedipal. So it can be pre-Oedipal maternal or Oedipal maternal transference, pre-Oedipal paternal transference, or Oedipal paternal transference. Displaced transference can be something that the patient will bring up during the session, but it might seem that it is related to someone else when the patient is describing them, but it might actually be something related to the therapist. How to look out for signs of this kind of transference? You try to listen to any comments that the patient makes. You might want to listen to any kind of stories that the patient narrates, which sounds similar to something that is going on in the therapy session. Something that might come up towards the beginning or the end of the session, and their general pattern of relating to others. So, this is the listening aspect of the technique that I used in therapy. So, whether to reflect about the transference depends on the level of understanding of the patient or the level of preparedness, readiness in trying to uncover the unconscious aspects. So, if we are doing supportive work with the patient, we might contain the transference mostly and not bring it up immediately and carry on with the supportive work. If we are using uncovering strategies in the session, then we can actually bring up the transference.